Assalamualaikum warahmatullahi ta'ala wabarakatuh. So today our group will present about the role and application of Qawaid Fiqhiyyah in pharmaceuticals. First, let me introduce myself first. My name is Iqmal Faris bin Muhammad Azlan with my metric number is 2022484558. Okay, so I will introduce to all of you the detail about our title. The Muslim jurisprudence, or in Arabic we call it Qawaid Fiqhiyyah. It is important because it directs how Islamic law is applied in many areas of life, including medicine. This maxim is a broad guideline that comes from the specific rules of Islamic law, or we call it in Sharia. They offer a framework for making decisions in new and complex situations when it is not possible to refer directly to primary sources. What is the primary sources? It is the Quran and the Hadith. Next, we go to relationship between healthcare and maqasid syar'iyah. Based on what has been studied and carried out by the Islamic leaders is to show the connection that has been existed for a long time between Islamic principles and medicine, as evidenced by citing the works of early Islamic physicians such as Imam Al-Razi and Ibn Sina. Contemporary publications that discuss the incorporation of maqasid al-Shari'ah in healthcare can also be used as a reference for this. We were able to divide the literature on the subject into the four main and significance group based on observation as well. So what are the four main and the significance group? They are as follows. The first one is decision making in medical practice, and the second one is knowledge discovery in bioscience. The third is professional ethics in medicine, and the last one, the finally is Sharia compliant healthcare services. As everyone knows, Sharia is a branch of Islamic law. It aims to guide people towards a healthy lifestyle through practical principles and beliefs. The main goal of Sharia is to prevent harm and promote knowledge of benefits, with the five important objectives identified by scholars. So, what are the five important objectives that has been mentioned by scholars? It is, the first one is preserving life, and then the second is the reason, the third is religion, and the second last is lineage, and for the last one is property. Since the early Islamic tradition, the connection between Islamic value system, which is Sharia, and medicine has been a subject of scholarly study. Early Muslim physicians like Ibn Sina and Al-Razi have highlighted the role of Islamic values in medicines and healthcare. Ibn Sina's work on medicine and health emphasized the importance of moral conduct in medicine, while the others, Al-Razi works on medicine emphasized ethical norms in medical practices. Contemporary Muslim writers have also studied the applications of maqasid al-Shari'ah and in healthcare practices. So we go next to the Muslim scholars. There have been discussed the ethical issues in medicine from an Islamic perspective, including principles, hospital practices, and bioethical concerns in the Islamic Islamic Fiqh Academy Journal.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Imam Zaid bin Muhammad Al-Rihan. My number is 2022461366. Now I will present about roles of Qawaid Fiqhiyyah in pharmaceutical. The first rule is give physicians, medical professionals and pharmacists clarification and direction about Islamic laws concerning medical matters. So Qawaid Fiqhiyyah or method of fiqh can give information or explanation to the physician, medical professional and pharmacist about the direction Islamic law regarding to the medical matters. What is the relationship between the laws and medical matters? It is can be used the substance, haram substance. So all these profession, which is medical profession and pharmacist, they can know which is the haram substance and the halal substance to use in medication. Next is assist in reducing the load of humans. We know humans have a lot of burden, so Qawaid Fiqhiyyah can reduce the burden of human to make human life more easier, so they don't have to carry the burden anymore. And the thirdly is assist contemporary academics or contemporary scholars in locating the legal framework for contemporary medical issues. It means we know nowadays a lot of contemporary medical issues have been arise from the community and from the society. So to answering the medical the issues that have been arise, so contemporary academics or scholars, they have to see the Qawaid Fiqhiyyah and look at the Qawaid Fiqhiyyah to make them more confident to answer the issues. Qawaid Fiqhiyyah also make them more easier to look up this method to answering all the issues that have been concerning to medical. Next, I will present about halal pharmaceutical. What is halal pharmaceutical? Halal pharmaceutical is drug products that are derived from a permissible source, such as animals, plants, organic or inorganic substance that follows a method of preparation, manufacturing and extraction that follows the recommendation of Islam. Halal pharmaceutical products should not be only free from haram constituents, which is haram substance, but they should also be tayyib. The term tayyib refers to a good or product that is clean, pure and produced based on standard process and procedure that have been stated by the law or Islamic Sharia. Tayyib is important for Muslim to make the substance of medication that got into our body is halal. So it is important for we as a Muslim. Then I will continue my presentation about importance of halal pharmaceutical. The first point is establish guidelines and standard to certify pharmaceutical that are halal. It is important for we as a Muslim to take halal pharmaceutical and know the halal pharmaceutical to establish guidelines and standard to certify the pharmaceutical. So halal pharmaceutical, they have certificate to show that the pharmaceutical or the medication is halal. So it is important and for we as a Muslim to take the halal pharmaceutical. Next, halal awareness as a concept was found to impact customer behavior toward the purchase of halal product. It is shown that customer behavior show that they so take note about the halal products. So in medication, halal awareness is so important because it was a concept to make mostly Muslim customers to take halal products. They will take halal product because they know the halal product is safe for them to consume it. The last is emerging industry with a great success potential. So when we have a halal pharmaceutical, we can help Muslim industry with in the pharmaceutical with a great success potential. We can help the growth of economic in halal pharmaceutical industry by the Muslim industry itself.
Now, for the next part, I will be explaining to you about the application of Qawaid Fiqh or Islamic legal medicine in the pharmaceuticals industry. The first example of the application of Qawaid Fiqhiyyah or Islamic legal medicine to the pharmaceutical industry is chemotherapy for cancer patient. As we all know, cancer is a very life-threatening disease which can take our life away, and one of the primary treatment for this disease is chemotherapy. However, chemotherapy could also cause harm to the patient, which is nausea, fatigue, and also hair loss. So with all that side effects that chemotherapy give to the patient, it brings the question whether it is permissible to do the chemotherapy if the chemotherapy itself cause harm to the patients. So to answer that question, scholars said that in Islam, chemotherapy is allowed because although it causes harm to the patient, it is seen as a lesser harm when compared to the harm that caused by the cancer itself, which is can take the patient's life. This is in line with the medicine principle Yuzal Dorar Ashaddu Bidoral Ahof, which means greater harm is eliminated by means of a lesser harm. In this case, chemotherapy is seen as a lesser harm, and the cancer itself seen as the bigger harm. So, the bigger harm will be eliminated by the lesser harm, which is chemotherapy. So, the patient could do the chemotherapy to eliminate the bigger harm. The next issue is cleft orificial surgery. Now, what does it mean by cleft orificial surgery? This surgery is a surgery that involves repairing cleft lips and palates to improve function and appearance for the patients. This surgery will of course cause a change in the face structure of the patients. So, that brings out the question whether this surgery it is permissible to do or not, because changing the creation of Allah, which is our face, is considered haram in Islam. To answer that question, that in Islam it is permissible to do this surgery only if it aims to reduce the significant harm toward the patient, and also improve the quality life of the patient. Anything beyond that, it is not allowed to do the surgery. The maxim used for this issue is ad-darurah tuqaddar biqaddariha, which means necessity is measured by its extent. This maxim teaches us that we allow to do the forbidden things only to remove the darurah, which in this case we allow to do the surgery only we want to reduce the harms, and also we want to improve our quality of life, not more, not less. Now, for the last example that I will be explaining to you is using lava therapy or maggot debridement therapy for chronic wound patients. This therapy raises ethical questions about using an animal for the treatment. People wonder if it's okay when the animals die during the therapy and stick to the skin of the patients. And also people asking questions whether the prey that has been done by patient is acceptable because there is a die animal in their skins. So, to answer that question, in Islam it is permissible to use this therapy for chronic wound patient because first, this therapy is an effective method to treat the chronic wound patients. In Islam, we encourage to seek the effective treatment to remove the harms toward us. Second, maggots are considered pure or tahir in Islam because there is no specific in Quran or Hadith declaring that maggots are impure. There is only pigs and dogs only that mentioned in Al-Quran. And also, fun facts, maggots, there is no blood in their body, so that if they die and stick to the skin of the patient, it will not counted as najis. So the prayer for the patients is acceptable. There is two maxim use in this issue, which is the first one is ad-darar yuzal, which means harm must be eliminated. In this case, we eliminated the harm, which is the wound of the patients, by using the laval therapy. And the second maxim used in this case is al-aslu fil asya al-ibaha hatta yadullu dalil ala tahrim. Which means the default rulings for things is permissibility until evidence indicates prohibition, which I mentioned earlier. There is no mention in Al-Quran or Hadith that stated maggots are impure. And that's all from me. Thank you.
Okay, so we're back to the conclusion. The conclusion of Islamic law and medicine are two things that are interconnected with each other with the aim of reducing harm and preserving life. We should also note that Sharia prescribes welfare laws, priorities exceptional situations, and provides a code of ethics in healthcare services. And then Islamic legal maxims guide pharmaceutical industry, ethical decision making, ensuring medical practices align with Sharia, or we call Islamic law, including the lava therapy, cleft orophacial surgery, gelatin use, and the more critical is the cancer chemotherapy. So I guess that's from our group. So inshallah, thank you for all of your attention. Assalamualaikum warahmatullahi taala wabarakatuh.